and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The government recently granted conditional approval for Qdenga, the first dengue vaccine to be approved for use in Malaysia. Now, this comes in the wake of an alarming 86% surge in dengue cases last year, with 100 fatalities reported, underscoring an urgent public health challenge. Now, with a national goal of zero dengue-related deaths by 2030, how will the introduction of Qdenga shape Malaysia's battle against this relentless disease? Joining us now is Dr. Koh Kar Chai, who is the Public Education and Advocacy Lead for the Dengue Prevention Advocacy Group, which is a collective of medical and community organizations. Dr. Koh, thank you for being on the show with me today. Can you begin maybe by sharing what we, the public, needs to know and understand about this dengue vaccine, Qdenga?
Well, this dengue vaccine is practically the only vaccine which we have in Malaysia at this moment, which has been registered for use. And it's I would say it adds into the armament of preventive measures which we have against dengue in Malaysia. And we know that throughout the years, we've been fighting hard against it with all sorts of preventive measures. I think this is a measure which is quite simple. All you need is, take the jab. In fact, a couple of jabs, and then, well, I hope that it will sort of, like what you say, shape the future of how we can prevent dengue in Malaysia.
Well, talk to me a little bit about the efficacy. How does this vaccine work? It works on all dengue serotypes, and you can take it even though you haven't had dengue before. Yes.
Yes, the safety profile is quite acceptable in the sense that it can be taken from the age of 4 onwards. Of course, with exclusion of those who are immunocompromised, the pregnant mothers, and those certain people who have got certain medical conditions which doesn't justify taking this vaccine. Okay, but apart from that, it is for age of 4 onwards, and it protects against all 4 strains of dengue. And as for the protection level, it's quoted as 80.2% against symptomatic dengue. That means you will not get symptoms of dengue, about 80.2%, and about 90.4% efficacy against being admitted to hospital for dengue.
Okay, so this doesn't actually eliminate or stop dengue or the spread of dengue. It reduces the risk of dengue-related hospitalization and deaths. Is that accurate?
Well, to clear up a bit of misunderstanding about vaccines in general. Many people are of opinion that vaccines will just stop the any virus from entering your body, and then full stop. That's it, right? If you remember the days of COVID-19 when that vaccine came out, people were of the opinion that, the moment I take the vaccine, I don't get the disease. But it's not so. Most vaccines will actually, it sort of induces an immune response in the body so that it will fight against the infection, and it reduces the severity of the disease. This is how vaccines generally work.
Well, I'm glad that you brought up the pandemic and our experience with the COVID vaccine rollout. I'm just wondering whether there are lessons to be learned from that experience, particularly in light of the recent revelation that the AstraZeneca vaccine had a rare side effect. I wonder whether that may not help the cause of kind of vaccine deployment going forward.
Well, we always have people who are hesitant about taking vaccines, but there's a very big difference now with the vaccine which have undergone the process of being developed for public use or for patient use, as opposed to the time of COVID-19 when the vaccines were rolled out in the, what do you call it, in a time of emergency. We needed something very badly at the time, and if you remember, the rollout of vaccines was very rapid, right? We did not have I wouldn't say no proper research, but everything was rush sort of thing, and ended up with a lot of people ending up with certain side effects. And if you ask me, the percentage was not great, but it was good enough to turn people off against the use of vaccines during the time of the COVID-19 pandemic.
Right. So you said, a certain level of vaccine hesitancy is to be expected. What measures can we take now to increase kind of public trust and acceptance of a vaccine for dengue?
Well, this vaccine has undergone, the proper time frame for development, and by virtue of it being registered by the National Pharmaceutical Regulatory Agency in Malaysia, or rather the Ministry of Health, I think people should have some trust in it, because this is different. Like during the time of COVID-19, the vaccines were just approved. I mean, it was not really approved, but it had to be used because people were dying left and right and entering hospitals, and it was a different scenario altogether. And this vaccine had been given time to undergo the proper research, proper studies, and even though it's a new vaccine, they have already undergone certain stages of development.
Mm. Dr. Koh, can I ask you, the current pricing of the vaccine is said to be around 500 ringgit, and this involves 2 doses, and it has to be taken at a certain interval. I think it's 3 months, if I'm not mistaken. How do you view the pricing of this vaccine, and is it a barrier to public take up?
Well, well, we always hope that the cost of vaccines will be much lower, and but looking at it with the effort being put into getting this vaccine out for use, I think the pricing at this current moment of time, I think is quite okay. If you mentioned about 500 for 2 doses, I think this is the nominal figure which you will get in outside, and I can see that it ranges between, let's take a ballpark figure of about 250. It will be plus and minus around that figure.
Okay. And the 2 doses, is that an impediment to vaccine take up? Is that uh, are consumers, they understand the need for that time interval and the need to complete dosage?
I think it's okay because many other vaccines you need to take it more often, or maybe you take more doses. With this, we are only looking at 2 doses for time being, 3 months apart, and that's it, right? Of course, pending further, when we move further in time, then we will see maybe new developments. But at this present moment of time, no boosters are indicated, and all you need is just these 2 doses.
Okay, so Dr. Koh, what would you like to see in terms of vaccine deployment? How this particular vaccine will be deployed in Malaysia?
At this current moment of time, it is only available in the private sector, but I hope that as we roll it out in the private sector, and as more and more of our people start taking it, the government may consider including it in our national immunization program and offer it to our public.
All right, thank you so much for speaking with me. That was Dr. Koh Kar Chai from the advocacy group Dengue Prevention Advocacy Malaysia. We're going to take a quick break here and consider this. We will be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about Malaysia's first MOH-approved dengue vaccine, Qdenga. Joining us now is Professor Dr. Sharifa Ezat Puteh, who is a specialist in health economy and public health at UKM's Faculty of Medicine. Dr. Ezat, thank you for being on the show with me today. I'm wondering how you view the current pricing of this dengue vaccination, Qdenga. We hear that it's ranging around 500 ringgit for 2 doses. Do you see that as a barrier to take up by the public?
Thank you very much, Melissa, for having me this morning. I'm very happy to be here. I really welcome the first sort of dengue vaccine in Malaysia, and congratulations to Takeda and the team. I think this is a very important and pivotal point to reduce dengue's sort of burden in Malaysia. As all of us know, we always have, sort of dengue problems or dengue outbreaks in our local communities and all. The price is a bit taxing on the population, as we know that, it range between, like you mentioned correctly, 500, some places might be a bit lower, some places might be a bit higher for the 2 doses. So what happened is that that takes a lot of toll for someone who has, let's say, 3 children or 4 children, let alone 1. The issue is that how do we make this more cost effective for the public, making sort of, but new vaccines are always, quite costly. It may take some time before the vaccine price actually comes down, since there's no competition at the moment. There's no competition from other brands. So it is left to sort of the company to work with the, let's say, Ministry of Health on how to make the vaccine price actually a bit lower.
Right.
Usually after a certain time, the vaccine price will actually decrease, but hopefully we don't have to wait so long. And it comes into our vaccine sort of preventable diseases, and hopefully into the Malaysian sort of schedule as soon as possible.
Right. Yeah, so maybe help us think through the health economics of this. How does the cost of Qdenga or any vaccine or dengue vaccine compare to the financial burden of treating dengue hospitalization?
The cost is definitely very high, because as dengue has a range between mild but also the severe. And what we are really scared are the severe cases, because they can come up with hemorrhagic fever, and of course it can be fatal as well. We've seen this in Malaysia, where we have not only the burden of people admitted due to dengue, but the possibility of them actually changing into or provide, the end result is more severe or fatal, where they may have dengue hemorrhagic and also death. This is very pertinent, especially for the younger subgroups, meaning that for the children and also the elderly, the risk is even higher. So because of that, the dengue producers, of course, remember I mentioned just now, this is a novel vaccine, meaning that this is something really new. Whenever anything that comes out, which is sort of novice and new, the price is going to be very high, because it takes cost not only to develop, but it takes cost to administer the trials, which is actually very costly. You have to do trials in many people. All these actually incurs a lot of costs. So when that happens, of course, the company will calculate sort of the best price per unit, meaning that the cost of the vaccine. And in certain countries, such as low middle income countries, most of the time the price has been sort of discounted, so they might actually give some leeway for certain low middle income countries, sort of lower the price for the population. Having said that, I'm sure that in other countries, such as developed countries, the price might be even higher than what we have in Malaysia. But having Malaysia as a middle income country and upper middle income country, the cost is still exuberant for certain groups of population, because as we know, we roughly have the lowest income quartile, the middle income, and so the upper income level in Malaysia, what we used to call as the B40, M40, and the T20. The M40 and T20, they might not have such a problem, but of course a bit of the M40 and also definitely the B40 will need some sort of subsidization. Hopefully the government will come up with some sort of social protection that is can be catered for this population.
So right now, if I understand correctly, Qdenga is only available through private healthcare. I believe in Brazil, Qdenga has been made part of the national vaccination program. Do you think that Malaysia should be thinking about the same?
We do, and I hope that the government actually look forward to that as well. I think it is in the pipeline. However, as usual, money is very scarce, especially the post-COVID area. The inflation has gone up. Most of the drugs prices has also gone up, meaning that the government has to really scrutinize, which of the vaccines or drugs that's going to be in the sort of the formulary, but also in our national immunization schedule that is going to be provided free. We don't have any sort of partial subsidization, meaning that whatever is given by the government, it is totally free, and we don't have sort of a co-payment or a co-insurance or a co-payment for that, meaning that it's either free or you get it in the private. So hopefully at one point in time, if the government feel or are able to procure some some vaccines for the Malaysian population. This is very good, but it's going to take a toll on the budget. Of course, they can prioritize, meaning that, it is only provided free for, let's say, the lowest income, or the areas where it is highly endemic, or in certain areas where, the density of this dengue burden is very high in certain states and things like that. That would be another way of looking at it, strategizing the best places or the best population to be targeted. This would be something that the government would have to look for, and of course it has to be discussed at their own levels of committees and so on.
Right. Dr. Ezat, maybe you can shed some light. When we think about the kind of pricing structure of a vaccine, what realistic steps can be taken to lower the cost beyond kind of waiting for market competition to even to level the playing field?
Yeah, you're absolutely right, because it's not easy to get anything or any drug into the sort of the free population groups, Melisa. So I would say that, some of the things that we can do, or the government can do, is actually negotiation with the provider, meaning the providers of the vaccine, which is Takeda in this situation, whether they are able to sort of absorb some of the prices, meaning that, it's either, like, say 50%, it's like discounting or something like that, where 50% can be actually subsidized by the government, and another 50% can be subsidized or sort of catered for by the company itself. If you look at certain oncology drugs, that is happening, for certain reason. So these prices by the oncology drugs providers are absorbed by the company, and the rest is subsidized by the government, or it is totally subsidized by the company, the pharmaceutical company. Yes, correct. There are already a few already happening in Malaysia. So this is for certain groups of cancers, hematological cancers. So the similar scenario or model can actually be taken up by Takeda as well, if they are able to do that. Another way would be if we are able to obtain some sort of help from an organization, let's say Gavi or UNICEF or something like that, and they provide, in a way, they subsidize, or basically they pay for the price of procurement, and the government would just have to pay for the cost of vaccination, meaning that, the school have programs or going to the public, for schools and things like that. It can also be done with the private institution, as what the Puteh B40 has been doing, where, if you're a sort of a subsidiary of the Puteh B40, you can actually obtain whatever treatment in the private GPs as well, but also the government. So this is something that the government can actually look at. But again, it's very reliant on the providers, but also if there are people or companies or institutions or even insurance companies that are willing to come in and help in that sense.
Right. Dr. Ezat, thank you so much for your insights. I appreciate your time. That was Public Health Specialist Professor Dr. Sharifa Ezat Puteh. We're going to take a quick break here and consider this. We'll be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the first dengue vaccine to be registered for use here in Malaysia. Joining us on the line now is Vanessa Daniel, who is the Acting Director of the Southeast Asia Regional Office for the Drugs for Neglected Diseases Initiative. DNDI is a non-profit which seeks to ensure treatment for neglected diseases are available, affordable, and adapted to the communities who need them. Vanessa, thank you for being on the show with me today. I appreciate your time. The dengue vaccine that we're talking about today is being sold at around 550 ringgit for 2 doses here in Malaysia. I'm just wondering what measures you think ought to be taken to make sure that the cost of Qdenga doesn't become a barrier for those who need them the most, particularly when we think about those who are high risk and low income communities.
Okay, thanks Melisa for having me. So that's a very broad question actually. For vaccine to be affordable in this sense, you can do many things. Yeah. But I think we first have to understand that to manufacture vaccine, this is a very capital intensive industry. I think you've had that discussion earlier also, that, to manufacture this, there are huge cost drivers, facilities, equipments, overhead, labor costs. These are some of the key drivers in which would eventually translate to the price at the end, right? Fortunately, there are solutions. We talk about government pricing, we talk about voluntary licensing, but I think very relevant to Malaysia, and especially having learned from COVID, is one important solution is for us to remember that we can actually utilize local pharma companies to manufacture these vaccines at the local capacity. Meaning we have pharma companies that have factories or plants, manufacturing plants, and we can equip them, either through government funding or venture capital sources, equip them to be able to take up sustainable tech transfer from bigger pharma companies who have those technologies. The benefits of this is, it's huge, because the first thing is national security. If we look at national security in the event of God forbid, a pandemic, okay, if we manufacture locally, then we have control of the supply, we have control of production, we can control the price, we can control the distribution. We would be very self-reliant, as opposed to waiting for a high-income country who would, if they have supply, then they would disperse it to us. So manufacturing locally would give us that national security aspect. Secondly, is the benefit is we could build a local capacity. Of course, compared to an expat, a local talent would be a lot lower in terms of labor cost. We would be providing employment opportunities, and more importantly, building the local capacity. So I think manufacturing locally is a huge solution, and one that we should not overlook.
All right. But Vanessa, what would it take for countries to be able to locally manufacture a vaccine, particularly one that is so novel like this Qdenga dengue vaccine?
For sure. The important part is equipping our local pharma plants with the facilities that they need to sustain this tech transfer. So in this case, if we need to buy machinery, if we need to build a capacity, if we need to make it a large manufacturing plant, increase the size, increase the workforce, if this requires funds, then maybe the government or policymakers can consider providing funds or co-funding this exercise. Equipping us in such a way. But it certainly goes beyond just the pharma company. It would require government agencies to be involved in this, to support it.
Right. Well, I recall a study that was published in Nature, the science journal Nature, that found, I think, more than 50% of the deaths that occurred during the pandemic could have been averted. I mean, that's millions of lives that could have been saved if COVID vaccines had been distributed more fairly, even without more supply or faster supply. And that's quite a startling finding. And I was wondering, how do we use that experience or those lessons to apply to new vaccines going forward? I understand that there is a huge capital investment into an R&D of a vaccine, but how do we ensure that we don't repeat the same mistakes of vaccine inequities that we did during the pandemic?
That's a question everybody's asking today, and I think for DNDI we published a paper somewhere in, I think, 2021, where when we collected the data, we saw by June. So the COVID pandemic started somewhere in 2019, right? And then everybody was in the race to produce a vaccine. But we saw by June 2021, okay, 60% of the population in at least 26 high-income countries had already been vaccinated, versus 85 LMICs only less than 10% have been vaccinated. So this is a huge gap, huge disparity. So some ways of moving forward is, as we already discussed, voluntary licensing, where we have big pharma companies making the vaccine more affordable to low-income countries by voluntary licensing deals. This means that local pharma companies can receive the tech transfers, manufacture them locally. The other thing we saw was a huge amount of unallocated reserves in the high-income countries. They had all these reserves sitting there, and then we had people in Africa, in Southeast Asia, who had not received their vaccines yet. So perhaps an important step for us, if ever we were put in a pandemic situation, is to make sure that we don't prioritize reserves, but we prioritize those who haven't received the vaccines first. And then when everybody has been vaccinated, then you put aside reserves. So the point here is nobody gets left behind, right? So that's important. And I think one more key point is we saw fantastic collaboration between government and pharmaceutical companies during COVID, both working together. Usually doesn't happen, but we saw this fabulous synergy, right? What we need to, I think what we could leverage here is pharma companies who profit from these government funds. Perhaps they could be encouraged to give back. They could be asked to give back a portion of their profits, reinvest a portion of the profits received into supporting pandemic preparedness activities, building capacities, making sure manufacturing plants for vaccines are built in other regions, reinvest to make sure we don't repeat the same mistakes again.
All right, Vanessa, thank you so much for speaking with me. That was Vanessa Daniel from the Drugs for Neglected Diseases Initiative, DNDI, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.